Good morning, everyone, and thank you again for joining us. I do have a few numbers to update us on, and these are from yesterday's update. So we have 204,336 cases of COVID-19 reported to Sacramento County. We are averaging about 2,953 cases per day, and this is a 7-day average. The case rate has risen to 189.5 per 100,000. We have a total of 2,576 deaths reported or confirmed, and we're averaging about 2 being reported daily. I do have to point out that with the deaths, because there is a prolonged process in confirming the cause of death, we do have quite a number that are still pending confirmation. The hospitalizations has risen to 464, and actually it's higher than that now. I think it's 494 reported with COVID-19, including 89 in the intensive care unit. For comparison, the highest case rate last year was 63 per 100,000. So the rate I just reported to you is 3 times that rate. The percentage of positive tests has also risen to 42.6%. In comparison, the overall positivity last year was 5.9%. We are seeing an increase in cases in the schools as well, and we are working closely with the school officials to handle that. We are also seeing an increase in the cases in the jail. And as of yesterday, there was 76 cases of COVID in the main jail compared to 27 on January 5th, and 48 cases in RCCC compared to 0 on January 5th. Although projections indicate that we likely will reach a peak somewhere in late January or early February, we're still seeing cases trending upwards. As a whole, the Omicron variant seems to have milder symptoms and compared to other variants. But for those who are unvaccinated and for the vulnerable or immune compromised, the impacts are still very concerning and very significant. Some of the things that we're doing to try and deal with the increase in demand for testing, as well as increase in hospitalizations, is working to increase staffing at the testing sites. We're also working with the hospitals and the state to increase surge capacity, as well as submitting requests for staffing support from the state. We continue to work with businesses to consult with them for implementing safety measures and providing testing kits when those are available. We continue to meet with the school superintendents to reaffirm the commitment to keep schools open, as well as consulting with them in how to handle the increase in the number of cases that they're getting, and to look for additional innovative ways of being able to continue to provide in-person learning for the students. We are also providing consultation for correctional health as they're dealing with this new surge in cases. For the general public, we continue to stress the importance of vaccinations and masking when going out into the public. Stay home if you're sick. And we ask that you preserve the emergency room visits for real emergencies. We also remind the public that they do need to make risk assessments and avoid gatherings, especially if they have conditions that put them at risk.